Right. Hello, this is Maria Fati, BSPH. My area of interest is in global health.
Hi, my name is Amaya Bernardes Ruiz. I'm also BSPH, and my area of interest is maternal and infant health.
My name is Liza G. I'm a BSPH and my interest is maternal health, and today we are presenting tetanus for our infectious disease.
What is tetanus? Tetanus is a serious infectious disease caused by bacterium Clostridium tetani. It affects the nervous system, leading to muscle stiffness and spasm, especially in the jaw and neck, which is why it's often is called lockjaw.
Tetanus dates back all the way to the 5th century BC, where its first clinical description was discovered. In 1884, scientists began to cause tetanus infection in animals to further determine the causes, where the bacterium Clostridium tetani was identified as the causative bacterium. In 1989, it was discovered that tetanus can only grow in areas that do not contain oxygen. In the 1980s, an antitoxin/vaccine was developed to fight against the infectious disease that would gain widespread attention and use well into World War II. And as of now, tetanus vaccinations are now routine for newborns and young children as they are at a very high risk.
How is it contracted? Tetanus is not a contagious disease and cannot be transmitted from person to person. Instead, it occurred on Clostridium tetani bacteria commonly found in soil, manure, and decaying leaf, enter the body through breaks in the skin, such as cuts, punctures, wounds, often from rusty nails or scrap metal, as well as burns or other injuries exposed to dead feces or saliva.
So the best way to prevent tetanus is through vaccinations, or at least 5 recommended dosages, as well as booster shots. Another good prevention is good care, which is important, and you should contact your healthcare provider if there's contaminated soil, saliva, or disease. So TIG is used by healthcare professionals when someone isn't up to date with their tetanus vaccinations and they have a serious wound. And since tetanus is a medical emergency, it requires critical wound care, TIG, antibiotics, and drugs to control muscle spasm.
Regarding the burden of disease, it disproportionately affects individuals in areas with poor health care and low vaccination rates. Babies and older adults are most at risk for the infectious disease, and treatment can get expensive and can require ICU level care. Many suffer from long-term effects even after recovery, and limited maternal immunization and unsanitary childbirth practices in some countries contribute to the rate of tetanus. There are 25,000 deaths yearly from neonatal tetanus. ICU care and treatment are very expensive in low resource areas, and many have to deal with long-term muscle and breathing issues.
So newborns and older adults are two of the highest groups at risk for tetanus. There has also been a decline in global tetanus cases over the past 2 decades due to increased vaccination coverage, better birth hygiene, and public health campaigns. But most tetanus deaths happen in underdeveloped countries due to limited access to vaccines and clean care. So although there are less than 40 reported tetanus cases yearly in the US, tetanus is still a public health concern due to its presence in low-income countries, and this is due to the lack of education and access of vaccinations or proper care to prevent or treat tetanus, and this leads to unnecessary deaths and morbidity rates, especially in the neonatal maternal population. And here are our citations. Thank you.
Thank
Thank
you.
you.